Welcome to Sato Caryu online nursing channel. This is part 2 video of weekend mock test organized by Sato Caryu online nursing channel every week. In this video, we are going to discuss 50 questions. This is a continuity of yesterday's video. Before going to today's question, please subscribe to Sato Caryu online nursing channel if you have not yet subscribed so far. Come, let's go for the first question of the day. An example for fat-soluble vitamin is option A, vitamin B1, B, vitamin B6, C, vitamin A, D, ascorbic acid. The fat-soluble vitamin is option C, vitamin A. Question number 52. Anemia is due to the deficiency of option A, hemoglobin, B, vitamin D, C, calcium, D, sodium. Anemia is due to the deficiency of option A, hemoglobin. 53. The sugar found in milk is option A, glucose, B, ribose, C, fructose, D, lactose. The right answer, lactose is the sugar present in milk. Question number 54. Which of the following phase of research process includes pilot study? Option A, empirical phase, B, conceptual phase, C, analytic phase, and D is planning phase. The right answer is in planning phase, pilot study comes under. So option D is the right answer. Question number 55. An artificial opening created in the large intestine and brought to the surface of the abdomen for evacuating the bowel is option A, nephrotomy, B, ileostomy, C, colostomy, D, ureterostomy. The right answer, colostomy is an opening created in the large intestine and brought to the surface of the abdomen for the process of evacuating the bowel. Question number 56. The drug which is used to dissolve a blood clot is known as option A, anticoagulant, B, vasodilator, C, thrombotic, and D is thrombolytic. The drug which is used to dissolve the blood clot is known as, the right answer is thrombolytic. Question number 57. The dissection of a arteriosclerotic plaques from the lining of the arterial wall is called as option A, endarterectomy, B, embolectomy, C, strapedectomy, and D is thrombectomy. The dissection of arteriosclerotic plaques from the lining of the arterial wall is called as option A, endarterectomy. Question number 58. The P wave is the P wave in an ECG represents option A, atrial repolarization, B, ventricular depolarization, C, atrial depolarization, and D is ventricular repolarization. The P wave in an ECG represents atrial depolarization. Question number 59. A method used to remove the hardness of water is option A, ortholidin test, option B, Clark's method, C, filtration, and D is Horrocks test. The right answer is the Clark's method is used to remove the hardness of water. Question number 60. Cooking slowly in a minimum amount of liquid is option A, steaming, B, stewing, C, poaching, and D, grilling. Cooking slowly in minimum amount of liquid is called as option B, stewing. Question number 61. The noise level of normal conversation is option A 30 decibel, B 60 decibel, C 80 decibel, and D is 120 decibel. The noise level of normal conversation is option B 60 decibel. Question number 62. Babies with a birth weight of less than 1000 gram are called option A extremely low birth weight babies, B very low birth weight babies, C low birth weight babies, and D preterm babies. Babies with a birth weight of less than 1000 gram are called option A extremely low birth weight babies. Now move on to question number 63. Death of newborn babies weighing over 1000 gram during first 28 days of life per 1000 live birth is defined as option A infant mortality rate, B neonatal mortality rate, C perinatal mortality rate, and D is under 5 mortality rate. Death of newborn babies weighing over 1000 gram during first 28 days of life per 1000 live birth is defined as neonatal mortality rate. Question number 64. At birth, the skin may be partially covered with a grayish white cheese-like substance called option A maculae, B lanugo, C papule, and D vernix caseosa. The right answer is vernix caseosa is a grayish white cheese-like substance cover baby at the time of birth. Question number 64. Option D is right. 65. The reflex elicited by stroking the cheek and noting the infant's response of turning towards the stimulated side and sucking is option A rooting reflex, B sucking reflex, C superficial reflex, and D is deep tendon reflex. The right answer is option A rooting reflex. Question number 66. The usual stool frequency per day during breastfeeding for babies is option A 4 to 6 times, B 2 to 3 times, option C 8 to 10 times, option D 1 to 2 times. The usual stool frequency per day during breastfeeding for babies will be option A 4 to 6 times. Question number 67. A teacher is using a mode of brain to teach the anatomy of brain. This is an example of option A systematic learning, B direct learning, C symbolic learning, and D vicarious learning. The right answer for this option C symbolic learning represents use of mode of brain to teach something comes under symbolic learning method. Question number 68. The morphology of the RBCs seen on peripheral smear in a case of thalassemia is option A macrolytic hyperchromic, option B macrocytic normochromic, option C microcytic hypochromic, and D is normocytic normochromic. The morphology of RBC seen on peripheral smear in case of thalassemia is option C microcytic hypochromic is the right answer. Move on to question number 69. Following is a long bones. Option A vertebra, B femur, C scapula, D maxilla. The Femur is the long bone among these three other bones. Question number 70. A branch of axillary artery is superior thoracic, B radial, C ulnar, D profunda brachii. So which is the branch of axillary artery? The right answer is superior thoracic artery is a branch of an axillary artery. 71. Spleen is related to option A 8th, 9th and 10th ribs, B 10th, 11th and 12th ribs, option C 9th, 10th and 11th ribs, option D 7th, 8th and 9th ribs. The spleen is related to the option C 9th, 10th and 11th ribs. Question number 72. A patient is taking aspirin, which finding would indicates the nurse that patient experiencing toxic effect related to the medication. Option A vertigo, B decreased night vision, C tinnitus, option D halos around light. When patient takes aspirin, the symptom like tinnitus, we can say option C is the right answer. Ringing sound in the ears indicates the patient has toxic effect related to this aspirin drug. Question number 73. When is the best time for the nurse to apply prescribed ointment to a patient with an inflamed skin rash? Option A in the morning before patient dresses. Option B when the patient rests for at least an hour. Option C after the patient's bath. Option D in the evening before bed. The right answer, the best time to apply skin ointment in inflammation of skin is after the patient's bath. Question number 74. The nursing intervention to be followed before starting electroconvulsive therapy is option C. Here we have two types of options. First, we list down the options. Take vital signs and record. B. Have the patient to void. C. Ensure that consent form has been signed. And D. Administer succinylcholine. In this four option, you just prioritize according to the um, number. So option A 124, B 134, C is 123 and D is 1234. So just arrange in the order of the following actions. Take vital signs and record, have the patient void, C ensure the consent form have been signed and D is administer succinylcholine. The right answer is option D 1, 2, 3, 4. Already it is in the right order only. Question number 75. World Cancer Day is celebrated every year on February 4th. The theme for 2019 is option A, we can, I can. Option B, not beyond us. Option C, I am and I will. Option D, together let us do something. What is the theme for World Cancer Day 2019, which is going to be celebrated in February 4th? The correct answer is option C, I am and I will is the current theme of World Cancer Day. Question number 76. So you have to match the following. So the answer is given directly. So you can see that option A we have bichinosis, B anthracosis, C siderosis, and fourth will be bagosis. So here the causes are given like sugar dust and coal dust and cotton fiber. You have to match the following. So we have the options and the correct match will be bichinosis will cause Coal dust, anthracosis will cause, we have the C, sorry, bicyanosis will cause by the iron. Next, anthracosis is caused by coal dust. Siderosis is caused by cotton fiber, and bagosis is caused by sugar dust. So option B is the right answer. So this was same thing which we have seen. Bicyanosis is caused by, yes, you can see the answer here. Bicyanosis, option B. Bicyanosis is caused by iron. Anthracosis is caused by coal dust. Siderosis is caused by cotton fiber, and bagosis is caused by sugar dust. Question number 77. Again match the following. You have black water fever, break bone fever, enteric fever, and bird flu. And what are the diseases you're going to get? You are seeing the B. Choose the right options from the giving, like the bottom you have option A, B, C, D. Choose correctly which is matching according to it. Let's see the answer here. Black water fever causes malaria. It is a malaria okay, and break bone fever will be matched with dengue. Enteric fever will be matched with typhoid, and bird flu is avian influenza, bird related to avian. So this is how we match this. Question number 78. Which of the following is a steroid hormone? Option A, prolactin, B, estrogen, C, thyroxine, and D, follicle stimulating hormone. The steroid hormone is estrogen. Option B is the right answer. 79. Duration of ventricular diastole is option A, zero point 0.3 seconds, B, zero point 0.5 seconds, C, 0.7 seconds, and D is 0.8 seconds. Ventricular diastole, the duration is option B, zero point 0.5 seconds. Question number 80. The plant form of vitamin D is called. The plant form of vitamin D is called option A, cholecalciferol, option B, ergosterol, option C, calciferol, and D, all the above. Vitamin D have different forms: animal form, natural form, and plant form. The plant form is option B, ergosterol, that is D2, vitamin D2, ergosterol is a plant source. Question number 81. Glucose present in urine can be tested by option A, Molish test, B, Benedict's test, C, Rothera's test, and D is Hare's test. The right answer is, by using Benedict test we can test the presence of glucose in the urine. Question number 82. Insulin is a option A, hormone, B, carbohydrate, C, lipid, and D is enzyme. Very simple, insulin is an hormone. Question number 83. Recurrent pulling out of one's hair is known as option A, somnambulism, B, trichotillomania, C, bruxism, and D is kleptomania. Recurrent pulling of one's own hair is known as trichotillomania. Option B is the right answer. 84. Recurrent and intense sexual arousal from dressing in clothes of the opposite gender is known as option A, transvestism, B, voyeurism, C, frotteurism, D, fetishism. Recurrent and intense sexual arousal arise from dressing in opposite sex gender is option A, transvestism is the correct answer. Move on to next question, 85. Which of the following group is commonly used for drug management of child with attention deficit hyperactivity disorder ADHD. Option A CNS depressants, B CNS stimulants, C anticonvulsants, and D major tranquilizers. For the treatment of ADHD, the drug of choice is CNS stimulants. Question number 86. A child ingested 15 paracetamol tablets 45 minutes back and is attended by a nursing staff in emergency department. Which of the order should a nurse do first? Option A gastric lavage, B monitor pulse and blood pressure, C start IV line, and D is use acetylcysteine. We know that acetylcysteine is an antidote. Yesterday video also we have seen about this. But the priority nursing action, what a nurse should do in this case. The right answer is option A, gastric lavage. The washing of stomach should be initiated to prevent absorption of paracetamol chemicals. Question number 87. Which of the following assessment data should the nurse consider as a risk for possible violence in a client? So here we have the actions like substance intoxication, past history of violence, and diagnosis of somatization disorder and argumentative behavior. So which of the following assessment a nurse should do, uh, which the nurse must consider as a risk factor for possible violence? So option A, action 1, 2, 3. Option B, action 1, 2, and 4. Option C, 2, 3, and 4. D is 1, 3, and 4. So choose the factor which can possibly cause violent behavior in a client. So according to this, the right answer will be option D, option B, 1, 2, 4. That is substance intoxication, past history of violence, and argumentative behavior. A diagnosis of somatization disorder is not much important in this case. It's not significant also. 1, 2, and 4 is the right answer. Question number 88. Again, you are going to match the following. Therapies are given, and here the process is also given. Aerosol therapy, incubator, oxygen therapy, gastrointestinal anomalies, phototherapy, nebulization, parenteral therapy, hyperbilirubinemia, and we have the options. Now you are going to match correctly. Uh, After matching, let's see the answer here. Now, aerosol therapy goes for nebulization, oxygen therapy goes for incubator, and we have the phototherapy which is used in hyperbilirubinemia, and parenteral therapy is used in gastrointestinal anomalies. So option A 1C, 2A, 3D, 4B is the correct one. Question number 89. Polio virus will be present in the infected stool for how many days? Polio virus will be present in the infected stool for option A 1 to 3 weeks, B 3 to 6 weeks, C is 6 to 9 weeks, and D is 9 to 12 weeks. The right answer is 3 to 6 weeks. The polio virus will be present in the infected stool. Question number 90. Dengue fever incubation period is option A 7 to 12 days, B 5 to 10 days, C 4 to 7 days, and D is 3 to 5 days. Incubation period of dengue fever is 4 to 7 days. Question number 91. Rice water stools are the characteristic feature of option A cholera, B sigillosis, C gastroenteritis, D ascariasis. Rice water stool are the characteristic feature of option A cholera. Question number 92. The Employee State Insurance (ESI) Act was passed by Government of India in the year. Option A 1948, B 1974, C 1982, and D is 1985. The ESI Act was passed by Government of India in the year 1948. 93. The National Health Committee, which is commonly known as Health Survey and Planning Committee, is Option A Boer Committee, Option B Chadda Committee, C Mudaliar Committee, and D Mukherjee Committee. The National Health Committee, which is commonly known as Health Survey and Planning Committee, is called as Mudaliar Committee. Question number 94. Again, we are going to match the following. We have the nerves and we have what they are doing the functions in the B. Accessory nerve, hypoglossal nerve, abducens nerve, trigeminal nerve. We want to match with muscles of tongue, lateral rectus muscle, muscles of mastication, and sternocleidomastoid muscles. So now we will try to match it, and after matching, let's see the answer here. Accessory nerve is supplying sternocleidomastoid muscle. Hypoglossal nerve supplies the muscles of mastication. Abducens nerve supplies the lateral rectus muscle in the eye. Trigeminal nerve supplies the muscles of the tongue. So this is how it is matched. Question number 94. Hope you understood. 95. Mother of a newborn child has complaints of pain and constipation. Which of the following interventions will the nurse instruct the mother to avoid? Option A. Intake of sedatives and laxatives. Option B. Intake of liquid paraffin and glycerol. Option C. Intake of plenty of water and milk. D. Intake of fruits and vegetables. Guess the right answer. The right answer for this question is option B. The nurse has to advise the mother not to avoid intake of liquid paraffin and glycerol, which can cause constipation as well as pain. Question number 96. A child is being treated for hypokalemia. When evaluating response to potassium replacement therapy, which of the following assessment findings should the nurse observe for? Option A. Improving visual acuity. B. Worsening constipation. C. Decreasing serum glucose. And D is increasing muscle strength. The right answer is when a child is under hypokalemia and who is having potassium replacement therapy, the main thing the nurse must observe for muscle strength, muscle pain, or any problems related to muscle should be monitored in priority wise. Question number 97. A patient receiving IV therapy through central line develops hypotension, cyanosis, and dyspnea. The nurse notes a crack in the IV tubing. What should the nurse do first? Option A. Clamp the tubing and administer oxygen. B. Raise the head of the bed. B. Slow the infusion and lay the patient flat. Option D is inform the doctor. The right answer is the nurse must clamp the tubing and administer oxygen because there is dyspnea and cyanosis also happening. So administering oxygen and clamping the tube till the tube is changed. Question number 98. A process that informs, motivates, and helps people to adapt and maintain healthy practices and lifestyle is option A. In-service education, B. Health education, C. Continuing education, D. Induction. The process that informs, motivates, and helps people to adapt and maintain healthy practices and lifestyle is option B. Health education is the right answer. Move on to question number 99. The curriculum planned by groups outside an educational institution is referred as Option A, instructional curriculum. B, institutional curriculum. C, societal curriculum. And D is hidden curriculum. The curriculum planned by groups outside the educational institution is called as societal curriculum. Now, the 100th question. The ability of the learner to use learned material in newborn situation is known as option A, synthesis. B, application. C, knowledge. D, analysis. The ability of the learner to use learned material is coming under option B, application. Application is the right answer. Here we come to the end of this mock test series of this week. Thanks for watching this video. Please like this video and don't forget to subscribe to Satu Carry Online Nursing channel if you have not yet subscribed so far. Meet you again with another good questions. Till then, take care. Bye bye.